Hi everyone, hope you're doing well and happy Friday. Finally have some gorgeous weather. It's been so rainy and cold and dreary in the DMV. So excited for some blue skies this weekend. Just gonna get my co-host in the room and then we'll get started. But today we'll be talking about the 988 mental health line and the impact that it's had in its short 6 months of being available to community. Hey Marshawn, how are you?
Hey Jewel, how are you?
I'm good. Happy Friday.
Happy Friday to you as well. How are you?
Doing good. Glad that it's not so gloomy outside for like what feels like the
Yeah,
first time this week.
right. I'm definitely gonna have to step outside and get some of this sun.
Agreed.
Definitely.
How are you doing?
I'm doing well. I echo the sun being outside, and I'm glad it's Friday. I'm looking forward to the weekend. Gonna catch up on some sleep and do a little household chores. So
Nice.
yeah, what
Sounds
do you
like
have
a lot.
planned?
Sounds like a lot of wonderful reset activities.
Yes, do you have anything planned?
Currently, no. My life right now is mostly just like coding and practicing coding and working on some client projects. So I'll be doing that and take some walking breaks. And
Okay.
yeah,
Nothing wrong with professional development.
we love professional development.
Period. Okay, well, do you want to go ahead and get started?
Yeah, just trying to get Whitman-Walker in the room, but I will kick us off. During the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs, sexual health, social determinants of health, and public health interventions. The community health team is here to educate and support you. My name is Jewel, and I use she, hers pronouns.
And my name is Marshawn. I use he, she pronouns, and Jewel and I work together to bring educational lives to the space with Whitman Walker's Health Community Team. Today, we're going to discuss more information around the new mental health crisis hotline 988. 988 for those who don't know, provides quality emergency mental health care in Central Maryland and are the local responders for calls to the National 988 helpline. Residing in residents in Baltimore City, Baltimore County, Carroll County, and Howard County, services include 3 local call centers that provide safe, supportive, and confidential emergency counseling, 24 hours a day free calls, referrals to long-term mental health and addiction recovery services, various teams of mental health professionals who can meet you where you are to provide in-person support, and they are most definitely committed to ensuring everyone in the community has access to the resources they need for their emotional health.
Thanks for that info, Marshawn. To continue, the 988 Suicide and Crisis Lifeline, formerly known as the National Suicide Prevention Lifeline, launched last July. And it transitioned to the former 1-800-273-TALK phone number to the 3-digit 988 number, which is a lot easier to remember if someone's in crisis. So great, great switch. The new number is intended to be easy to remember, similar to how people can dial 911 for medical emergencies. Since that transition, in the past 6 months, about 2.1 million calls, texts, and chats to the new 988 number have been routed to a response center, and of those, around 89% were answered by a counselor. And this is according to CNN analysis data from the Substance Abuse and Mental Health Services Administration in the U.S. Department of Health and Human Services Department. They oversee the 988 line. Many of the calls that went unanswered were due to callers hanging up before reaching a counselor. Data shows that December 2022 versus December 2021, calls answered increased by 48%, and that chats answered increased by 263%. Additionally, texts answered increased by 1,445%. So it's really doing amazing work.
Yes, I can't imagine that increase of workload. Although the 988 Lifeline has also been testing a pilot program specifically for LGBTQ plus community members in partnership with the Trevor Project, in which calls, texts from LGBTQ youth have the option of being connected with counselors specifically trained in LGBTQ inclusive crisis care services. So everyone, I know you're like, what are they talking about? How does this work? So let me tell you what to expect when you're reaching out. When calling, you'll first hear a message telling you you've reached 988. Next, you'll hear a little music hold noise while you're quickly being connected to a counselor. Next, your specialized counselor at the 988 call center closest to you will answer the phone. Then the counselor will listen, provide emotional support, and share resources for long-term support. All calls are always free and confidential, and you will always be treated with the utmost dignity.
People can call or text 988 to talk about a lot of things. They include thoughts of suicide, relationships, economic worries, anxiety, sexual identity, drinking too much, drug use, feeling depressed, mental and physical illness, loneliness, trauma, and more. If you or someone you know has mental illness or is struggling emotionally or has concerns about their mental health, there are ways to get help. Please use this 988 resource to find the help you, your friends, or your loved ones need.
Right. Everyone, when life gets tough, it can most definitely feel overwhelming, but it can get better. Whatever problems you're dealing with, 988 is here to help you. Thank you all for joining. Be sure to honor your queer identity in 2023 by taking more opportunities to prioritize your own needs and happiness. And before we go, we just want to share a few reminders about HIV and STI prevention and testing services available through Whitman-Walker Health. To learn more about Whitman-Walker Health's testing hours or locations, visit our website at www.whitman-walker.org/testing. HIV and STI testing are available by appointment at both our Southeast and Northwest locations. Please call us at 202-797-4439 to schedule a testing appointment, and be sure to follow our website and Instagram for the most up-to-date information and hours. If your community or organization is interested in Whitman-Walker's community health team providing mobile health services in your neighborhood, please contact us at mobilehealth@whitman-walker.org via email. To access HIV prevention tools like PrEP, PEP, or start treatment for HIV with Whitman-Walker Health at any of our locations.
Thank you. And before we go, we want to give some reminders about COVID-19. So if you've already been vaccinated, congratulations. You've taken a really important step towards preventing yourself, your loved ones, and your community from getting sick. Multiple variants have soared across the world, and it's totally understandable why you might want to keep wearing your mask, as there aren't a whole bunch of measures or prevention measures in place to kind of ensure who's been vaccinated, who's mask wearing, all of that good stuff. And we all know that the vaccine is not 100% effective at preventing new cases of COVID-19, but it's very effective at helping keep people out of the hospitals with COVID, helping people not get too sick from COVID, and help preventing deaths related to COVID. So just all in all, please stay alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Please reach out to them at 202-207-2480 to make an appointment. And if you're having trouble making an appointment with them, or they're just not close by for you and you're a DC resident, you can visit vaccinate.dc.gov or call 1-855-363-0333. Maryland residents can visit covidlink.maryland.gov or call 1-855-634-6829. And Virginia residents can visit vaccinate.virginia.gov or call 1-877-829-4682. If you have not gotten a vaccine and you're not looking to get a vaccine, please continue to follow CDC guidelines for mask wearing, social distancing, and the like, as well as quarantining. It's just really important that you consider getting the vaccine and discuss COVID precautionary measures with those who are around you, but especially you want to be mindful of masks and keep your distance when you don't know whether folks who are around you and in closed, poorly ventilated spaces have been vaccinated or not.
Thanks for sharing that, Jewel. And last but not least, a quick monkeypox update. According to the CDC, there are more than 29,000 cases of monkeypox documented in the U.S. In D.C., walk-up vaccinations will be provided on a first-come, first-served basis to eligible residents, and hours may vary upon location. You can pre-register for the monkeypox vaccine appointment and learn more online at preventmonkeypox.dc.gov. Virginia residents, Virginia is currently working with local care providers to contact trace and identify those most in need of the monkeypox vaccine. Varying counties in Maryland are allowing residents to pre-register for the monkeypox vaccination, and the Maryland Health Department just released a pre-registration system. Please visit your state's local health department for more information on how to register and get vaccinated against monkeypox. Thanks, everyone. Remember to follow us on IG, Facebook, and Twitter at Whitman-Walker, and be sure to check out the website at www.whitman-walker.org for the most up-to-date information on our services and hours of location. For more COVID-19 resources and general Whitman-Walker Health Services, please give us a call at 202-797-4439, and be sure to follow our programs and the Whitman-Walker family at Real Talk DC _ and No Filter DC on Instagram. Thanks, Jewel. Hope you have a great weekend.
Thanks, Marshawn. Same to you. Bye, everyone.